When we're talking about diabetes um, emergencies or any sort of diabetes issues, sugar issues, things like that in the backcountry, it's important to recognize how to notice them, the signs and symptoms. But just like some of the other things that we've talked about up until this point, you also want to be able to know ahead of time if someone in your group is a diabetic. And just like anything, we want to make sure that we know where they keep their medications, what this looks like, how they know it's coming on, and what you can do to help. So, that being said, if you have, there is always a chance in the backcountry that you come around a corner and you see something, that looks unusual or scary, or that someone's not feeling well. Um, and that's when you would just start going through all of your assessment, your patient assessment, and taking everyone through. Hopefully, you have a second person with you that you can delegate to, but if not, you'll have all of the tools at the end of this class to figure out what's happening. So, if you see some of these symptoms, you'll want to ask the person, are you a diabetic? Do you have any diabetes? Um, Maybe they're not insulin dependent, or type 1 versus type 2, but maybe they know that they have insulin issues or high blood sugar or something to that effect. So, the signs and symptoms, what you're looking for if you see someone with diabetes or someone in your group, is dizziness or shakiness. They'll probably be complaining of a headache. Their skin will be cool and moist. So think like a light sweat. There's typically changes in behavior. So you'll see this person become very irritable, um, potentially aggressive, argumentative. Think of that hangry, put in air quotes, if you will, that you might have seen someone, but this is obviously a more serious version of that. So in diabetes emergencies, if the person is responsive and able to safely swallow, it's really important to give them 15 to 20 grams of sugar. In fact, I recommend strongly that you have something like Smarties, if anyone remembers those candies. I feel like I haven't seen them in a while. Um, in your first aid kit that you have that's easy to grab, that you can give someone what they're give someone some sort of sugar, so that way they can, that's easy and quick to go into their bloodstream, to help boost them back if they don't have any sort of medication. So it's important to check the labels of the products to determine how much the package contains. So knowing how to read nutrition labels is going to be a really important part of how to treat any sort of diabetes emergencies. It's important to note that when looking at this, that you're looking at the serving size. So you're not giving someone too little, too much, right? And you're going to look at those total carbs, because sugar falls under carbs. So we're looking at total carbohydrates, and that's how we're going to get someone's blood sugar up. In the front country, you're going to dial 911 immediately if there's any sort of diabetic emergency. If this person becomes unresponsive, if this person cannot swallow, if this person doesn't feel better after giving them sugar for 10 to 15 minutes, or you don't have any way of treating them in the front country, you're going to call 911. In the back country, if someone has some sort of diabetic issue, then you're going to want to evac them, take them out of the back country and start to hike them out, or something to that effect. If the person is responsive, able to swallow, can take the sugar, everything goes according to plan, that's still an evac. If the person is, things become detrimental, the person becomes unconscious, or the person's not getting better, that's a rapid evac, and we need to call search and rescue.